I, Dr. Abhijit Mhapankar, practicing pediatrician in Nerul, Navi Mumbai, expresses deepest regard to all of you on behalf of Navi Mumbai IIP. As we all know, we are celebrating World Breastfeeding Week between 1st to 7th of August this month. Our esteemed organization seizes this an opportunity to underline the significance of breastfeeding. Mother's milk is best for the baby. This is a proven fact. To practice successful breastfeeding, all of us are supposed to follow the 10 steps of successful breastfeeding. Baby after the delivery should receive the breastfeeding as early as possible. And that is mentioned in the 4th step of the successful breastfeeding, which is early initiation of breastfeeding. However, in practice, this is not correctly followed and the first feed to the baby is more than often delayed. Why does this happen? This is because all of us, after stabilizing the baby, instead of giving breastfeeding to the baby immediately, are busy with doing certain things which can be delayed. Those are measuring the baby's head circumference, height, weight, giving vitamin K. These things are also important but can be done later on after giving the first breastfeed to the baby. To overcome this challenge, the art of breast crawl can be practiced so that we start breastfeeding as early as possible. So now what is breast crawl? Breast crawl is the innate ability of the newborn when placed between the breast of the mother on the chest with direct skin to skin contact. The baby identifies the breast, locates the breast, reaches onto the breast and starts breastfeeding on its own. This is called as breast crawl. Breast crawl is not a new concept. It is almost 20 years old concept. However, unfortunately, this is not practiced by most of us. If we put this practice of breast crawl, the challenge of overcoming early initiation of breastfeeding can be done. Now, how can we do breast crawl? After the baby is born, the baby has to be delivered on mother's abdomen. The primary steps of taking care of the baby should be done on mother's abdomen. After you have ensured that the baby is breathing well, baby is hemodynamically stable, the baby needs to be introduced to the mother. The baby should be taken very close to the mother's cheeks. The mother should be allowed to kiss the baby. The cheeks of the mother and the baby should touch each other. After this, you need to put the baby on the mother's chest between the breast with direct skin to skin contact. Care should be taken that when you are drying the baby, the amniotic fluid on the palms of the hands of the baby should not be wiped off. Similarly, the breast and the chest of the mother should not be clean dried. Now when you place the baby on the mother's chest between the breast, now baby is active enough to initiate the process of breastfeeding. Immediately after the birth, the baby is in the alert phase. During this alert phase, the baby can latch onto the breast very easily. However, if you lose this period of alertness, then the baby goes off to sleep for several hours and the early initiation of breastfeeding is delayed. Once you put the baby onto the mother's chest, the baby will reach onto the breast and start breastfeeding. Now let's try to understand the science behind the breast crawl. The baby is born with intrinsic ability to perform this act. The innate programs in the baby's mind or brain has a set of instructions how to go about this story. These innate programs are nothing but an interplay of sensory, motor, neuroendocrine and cortical functions which enables baby to perform this act. All this put together directly or indirectly helps the baby to identify the breast, locate the breast, reach onto the breast and start breastfeeding. Now how does the baby identify the breast? Immediately after the birth, the baby has a visual acuity to recognize facial patterns. By virtue of this, the baby recognizes mother. The baby's visual acuity has a quality to identify black and white spots. So the baby identifies hyperpigmented nipple also. The amniotic fluids which is there on the baby's palms, the taste and smell of this amniotic fluid is similar to the secretions of the secretions of the breast and nipple. So the baby is able to identify the breast and the nipple also. In this way, the baby has identified the breast and the nipple. The second step is, how does the baby reach to the breast? Here, the primitive neonatal stepping reflex comes to the baby's rescue. The baby starts pushing onto the mother's abdomen and propels itself towards the breast. After the baby has propelled itself towards the breast, the musculature of the shoulders, arms and the necks helps the baby to move sideways towards the mother's breast. The reaching out movement of the baby's hands will make the nipple protracted, erect, and this helps in the latchment. After all of this is achieved, the baby will nicely latch onto the breast and initiate breastfeeding. This roughly takes around 30 to 45 minutes. The breast crawl, which is an innate ability of the newborn, has to be promoted so that the early initiation of breastfeeding can be done. The advantages of breast crawl is early initiation is possible. During the process of breast crawl, there is a direct skin-to-skin contact of the baby's and the mother's chest. This helps in maintaining the temperature of the baby correctly. This also helps in maintaining the sugar levels of the baby after birth, helps in bonding of the mother and the baby. The mother's process of delivery also becomes smooth. As the baby kicks onto the mother's abdomen, the placenta can be expelled easily. As the baby handles the breast of the mother, oxytocin surge is there. This oxytocin surge causes quick contraction of the uterus and prevents the risk of postpartum hemorrhage. Friends, we have seen the breast crawl is loaded with multiple advantages to both mother and baby. So all of us, let's pledge today to come together, all the doctors, community healthcare workers who are involved in mother and child healthcare should come together and put this art of breast crawl into practice so that the baby gets its birthright, that is mother's milk. Thank you.